Welcome! I'm Chuck Keels, co-founder of Living Hope Cancer Foundation. You can find us at getupandlive.org. I'm glad you're joining me today to learn more information about having a mastectomy, whether it's for yourself, a spouse, or a loved one. So what is a mastectomy? It's a really good question, and I'm all about doing your own research and understanding what you may be encountering. A good way to combat fear about something is to educate yourself with knowledge about it. Questions like, what should I expect and what is it all about, are normal and good ones to get answers to. The more you can advocate for yourself, the better. This ties into knowing what your patient's rights are, and you can decline treatment if you don't want it. A mastectomy is the removal of one or both breasts. A mastectomy is not a lumpectomy. A lumpectomy is a removal of the lump in the breast via a small incision. It is quite common for someone with a breast cancer diagnosis to undergo a double or a single mastectomy, as it's considered standard of care for stages 1 through 3. With stage 4, it's up to the oncologist to decide whether the patient would benefit from surgery. So the primary goal with a mastectomy is to remove the tumor burden. This lessens the risk of reoccurrence elsewhere in the body. So often a patient will need to choose between having a single or a double mastectomy. A single mastectomy is the removal of the entire breast on one side, and a double mastectomy means the removal of both breasts. I frequently see patients question whether they should have a single or a double mastectomy, and there are several factors to consider when making that decision. One would be that you need to find out what stage and grade of the diagnosis is. The lower the stage and the lower the grade, statistically, the less chance of spread. A second factor to consider in making this decision is what your own personal preference is. When I was first diagnosed, I was still in my early 40s, and I didn't want to be lopsided, and because I had high-grade, fast-growing cancer, I chose to have both breasts removed. So I recommend you do your homework, find out your stage and your grade, and ask your doctor any questions you may have. Go into this decision well-informed and confident. So join me in the next video where we'll discuss breast reconstruction.